So we're going to look at the quadriceps. So you have your patient long sitting, and the action you're going to ask them to do is straighten out their knee. If you'll straighten out your knee, please. Excellent. So what we're looking for is vastus medialis, which is right here, vastus lateralis, which is right here, and these two muscles kind of angle like this. Rectus femoris muscle belly will be right here, top half of the thigh, right in the center. Those are all the muscle bellies. Now the distal tendon, and you can relax your knee, is going to be right underneath the kneecap where the quadriceps comes and attaches at the tibial tuberosity. So right above the tibial tuberosity, you'll feel a nice little springy tendon. That is the distal tendon of all the quadriceps. And the action again is straighten out the knee, and you'll feel it harden. Okay, if you'll turn over, we're gonna look at the hamstrings next. Okay, and we're gonna be looking down here right at the bend of the knee, the popliteal fossa, for the tendon. So ask my patient, can you bend your knee just a little bit? And he'll hold that. Here on the lateral side, we're going to have biceps femoris. Then we come towards the middle, and we've got this tendon right here. This is semitendinosus. And just medial to it, a little bit deeper, a little bit flatter, is semimembranosus. So boys to men. Biceps femoris, semitendinosus, semimembranosus. Thank you. And if you'll come and sit up on the edge of the bed, we're going to look at tibialis anterior. So this will be on the lateral side of the shin bone, your tibia. And the action you'll ask your patient to do is pull your foot up towards the ceiling, dorsiflexion. And this is the muscle belly. And this is our distal tendon as it comes and crosses in front of the ankle. Okay, it dorsiflexes, it also inverts. So I can ask my patient to invert, or I can ask them to do both at the same time. Perfect. Boom, boom. Okay. Oh, our extensors. Do you mind standing up for me, please? Okay. So now we have extensor digitorum longus. We're going to be looking at the tendons. Ask your patient to pull their toes up towards the ceiling, and we're looking at the tendons to the last 4 digits. Extensor digitorum longus would be any one of those tendons. Extensor hallucis longus is the one going to the big toe. Okay. Do you mind sitting back up here and facing over that way? Perfect. No, you can stay seated. Yeah, there we go. Okay, we're going to look at proneus longus and brevis. So they plantar flex. So if you'll put your foot down, and they evert and come out. So this big tendon right above the lateral malleolus is going to be proneus longus. And then you're going to get a tendon that inserts at the tuberosity of the 5th metatarsal. This is proneus brevis. Thank you. If you will stand up for me, we'll do gastroc and soleus, and just turn your back. Thank you. Okay, if you can keep your knees straight and go up on your toes. Okay, this is gastroc right here, muscle belly, distal tendon. You can see the medial head's a little bit lower than the lateral head, but all of this is gastroc. Okay, you can come down. Now if you will bend your knees just a little bit, and now still raise up on your toes. Nice soleus. You can see soleus here and here. Okay, that's the muscle belly. It again will join into the same distal tendon, the Achilles tendon. Okay. Last things we have are Tom, Dick, and Harry. If you'll sit and face that way this time. Okay. We're going to be looking at the medial side of the ankle now. Peroneals were on the lateral side. Medial side, we're going to be looking at tibialis posterior. Okay, tibialis posterior plantar flexes, but invert, so bringing your foot in like this. And this big tendon right here, right above the medial malleolus, is going to be the tendon of tibialis posterior. And you can relax your foot. Now, right behind, or posterior to the medial malleolus, you're going to have 2 little tiny tendons They are like strands of spaghetti, so they are tiny, but they're going to be flexor digitorum and flexor hallucis. So we call tibialis posterior Tom, flexor hallucis Harry, and flexor digitorum Dick, so it's Tom, Dick, and Harry. All I'm going to ask you to do is put your fingers right behind the medial malleolus and ask your patient, can you curl your toes for me? Excellent. And you're trying to feel the tension. I'm not going to ask you to distinguish between digitorum and hallucis.